Hey guys, Super Gadget Guy here. For those of you who keep track of all my videos knows that I'm a diabetic, and although I'm on the pump therapy now, I was on the multiple daily injection therapy for about a year. So I know those of you who are diabetic interested to see how other people are doing. Those who aren't or who have family members that are want to know what it is like to be diabetic and. Well, the best way I can think of is to show you what I have to do, well, what I had to do every day to basically live with this condition. And yes, type 1, so fairly skinny. It's something that we don't know the cause of it yet. A lot of factors like environmental, virus, genetics, who knows? We don't know. But I have it, so for a long time I've been ignoring it, and finally my wife gave me the courage to deal with it. So here it goes. So this was my old pack. As you can see, there's a temperature indicator because you have to keep the pen reasonably cool after you open it. I'm just trying to show you what I do, and if you have any questions, you should check with your doctor or endocrinologist or nurse, some medical professional. I am not a medical professional. I am only a diabetic patient, and I'm just trying to show you what I've done to deal with this. While I was on this, my A1C was 5.3. I didn't feel any lows. I am definitely hyposensitive. It's definitely, to me, good number, but to my endocrinologist, it's a bit too low. I can go a little higher. But yeah, I was 5.9 on the pump, so I am definitely be able to manage it. You can definitely do it. Pump is a lot easier, but you can definitely do it with these pens. So let's get it started. So I was on a sort of two different sort of insulin. One is a fast-acting. It's the Novolog Flex pen. They're the same operation, but this is the fast-acting. So this is the pen that I take before a meal, before a carby meal. Basically, I take it because I'm still really afraid of needles. I do it only twice a day. Lunchtime, I try to have like salad. Nothing, no carb, not even like seeds, maybe very little like sunflower seeds and stuff. No carb whatsoever lunchtime for about a year. That's how much I'm afraid of needles. I'm willing to eat leaves and grass for a year. So this is the Novolog. And for nighttime, I do a slow acting insulin. This is Lantus. And Lantus starts acting basically 4 to 6 hours after injection and basically has a very flat reaction, so basically lowers your background sugar level, basically keep it low. This is fast acting. Basically for me, it starts working within 10 minutes, 10 to 15 minutes, different based on person, and it peaks out basically like 75% of it will be used up by like 2 hours. Different person differently. If you want to know more details, check online, ask your doctors, they'll be able to tell you how fast acting insulin works. This thing lasts from basically until hour 20, so it's a very slow background, flat line, very flat. This like peaks out, so you have to use the two. Nighttime before bedtime I will inject with this, and before meal I will inject myself with this. So before the meal injection you check your sugar. So basically I have to carry around this strips. Still afraid. And you have basically a lancet device. I have a different video to show you what this actually does. You basically inject the needle into it, and then you pull back and poke yourself and check your blood sugar level. And based on the level, you have to estimate how much carb is in the meal, and plus any correction that you need to do. So for example, my goal is 100, and before meal I was at 200. I need to account for the number of carbs I'm gonna eat, plus reduce the 100 extra from 200 to 100 with the right amount of insulin. So it's basically a little calculation. And when it comes to injection time, I use an empty bottle, this is how I do it, as a disposal waste container, because sharps containers I use are fairly large. They're not portable. This is like, I don't know, 1 quart size. So I use this as a temporary portable storage. As you can see, it's just the old container, and I apologize, there's a little bit dry blood in it. So what I would do is, what you should do is basically, I'm not going to inject myself, but you will see the needle to show you what it's like. So before meal, check myself, let's say the number is really good, it's 100, and the meal I'm going to take, I'm supposed to do 10 units of Novolog right here. So what do is, so you can see, there's a manufacturing date, make sure it's not expired, and once the pen, you puncture the pen, start using it, well, before you use it, you should always store it in the refrigerator. Not the fridge, but refrigerator. Make sure it's in a cool place. And once you puncture it, start the first use, you have 30 days to use it. Because there's a preservative in it. It has a very sort of tar-like smell. That's the preservative. Insulin itself has no flavor. So what you do is that you will rip, I'm going to show you, do a dry demonstration. So let's show you my tummy here. Okay, here we go. Okay, you're gonna see my stomach. This is my infusion set injection site. This is my current infusion set. I will do a separate video to show how I would insert the infusion set. So basically, you want to pinch your stomach. You want an inch of fat, and this is where you will do the primary injection. And you want to basically keep in this zone right here. This is how I would do it. Check with your doctors again. Don't inject too close to the belly button because this is very sensitive. It will hurt. It actually doesn't hurt. The injection itself does not hurt, believe it or not. At least with the Novolog, with the fast-acting insulin. So what you will do is you will take the alcohol wipes. You will rip one open, and you will clean the injection area. You want to do a sort of circle from inside to out. That way, if there's any contaminant on it, you are not basically wiping back and forth, right? You're basically going from inside out, and make sure it's dry before you do the injection because it will hurt like hell because of the alcohol. Then becomes the pin prepping, right? You basically remove the cap. This, remove the cap, and grab the sort of the needle. I use the BD Nano, which is this is the smallest needle they have. It's a 32 gauge, and it's 5/32 of an inch, or 4 millimeter. Basically, the needle dimension is 0.23 millimeter in diameter and 4 millimeter long. It is a very, very small needle. So what do? You remove the foil. That expose the not the actual needle, but the part where you insert the pin into. And then you twist it. It locks, and you remove the protective cap, and now remove the needle guard. Now the needle is exposed. Apologize if you're afraid of the needle. This is the smallest needle. I hope it focuses. It is very, very small. It's barely invisible. And now what you do is you prime the pen because there's air basically throughout the entire needle part, right? So you want to click it to be 2, as you can see. Back to 0 now. To show you the dial, click this. It basically, you can hear 2 clicks, and then the count is on 2, and you will press the orange part, and that will cause the insulin to come out from the tip of the needle. Now the needle itself is filled with insulin, right? So now if you do 10 units of injection, you're actually getting exactly 10 units, because as you can see, 2 units is very small. We're dealing with very small amount of liquid here. 100 units is equal to 1 milliliter. So that is very small amount of liquid. Then you basically turn it to 10. Make sure you double check. You can count. If you can't see it, you can count it. If you just twist this, you're not doing any injection, right? So if you start, like say, if I can't see it, because some people have bad vision, you can just count. If you can see it, you can do a visual confirmation. Oops, I'm doing it wrong. Probably here. So you can do a count, and you can also do a visual confirmation with the window. Then when it comes to injection, so what I do is, I'm not going to inject myself, don't worry, is basically you want to pinch it, and then you basically go straight in, and then once it's in, you press the counter down, and then you basically inject yourself, and then you count to, let's say, 5 Mississippi, and then pull out, and then that's it. You let it go. So the first time I did it, I had to do it myself, and it was so horrific. Even though this tiny needle, in my mind it is like huge, right? It is like it's gonna basically shoot through me. It's gonna come out the other end, come out of my back. It's gonna be blood everywhere. It was really scary. So while I started doing injection, my hand was like basically shaking, and I'm like, oh no, I'm gonna poke myself 20 times before this thing go in. Basically, just take a deep breath, relax. It is not gonna hurt. Now, if you're really afraid that it might hurt, or you had like a bad injection the meal before, what do is you do a quick slap, then you do injection. That will basically temporarily numb the area that you're going to eject, and then wash your hands before you do it, of course. You slap yourself really quick, and then you can pull it sort of to the side, and then you injection and you let go. You don't feel it, which is the weirdest thing. This is a very tiny needle. You don't feel it. So after you've done the injection, what do is, I don't reuse these. I only use it once. But it's a cost is a factor. They're not cheap. I think they're like 30 cents a piece with insurance or without insurance. I don't remember. So if you're, if you only use it, do not share with anyone, obviously. But if you're only the user of it and you are financially constrained, you could potentially save it. Just don't put the guard back on, and just put the cap on. But I do not recommend it because the tip of the needle are like lubricated with silicone, so they're easy to go in, and they're dull, and any sort of bump, so you can see it's very small, even though it's very, any bump or touch it, it might not be straight. It will make it very painful on your injection. Just throw it away. So what do is you put the protective cap back on, and then you start rotate it counterclockwise, lefty loosey, and then toward the end just grab it and then pull, and then you can see it's coming out. The needle is in here, and then this is where the used strip container comes in, because you don't want to poke yourself, and you just put it back in and lock it. And once you get home, you can just empty this out into the bigger sharps container, so you can keep this with you. And then always remember to cap the pen. You have to do this before every meal. When I say it doesn't hurt, it doesn't, with, at least to me, with Novolog, but Lantus, on the other hand, hurts. Because Novolog, you only deal with what you eat, right? Really small amount. This one, 50%, again, average of your total daily insulin dosage should be less than 50% should be Lantus. So let's say your total daily dosage is 40 units. Around 15-20 units should be from Lantus. As you can see, 20 units is a lot. It's a lot of Lantus going in. And Lantus, from what I read on the internet, I haven't verified it, it's basically, in order for it to be a slow-acting insulin, it basically forms a little crystal. It's very acidic. It creates an acid crystal, and it dissolves slowly. And that's how it works. And man, it hurts sometimes. It hurts. It's just like you feel like a burn, but it goes away. It's not that bad. I'm making it sound like worse than it is. But I did have one really bad experience with it, is that I hit a vein. It doesn't happen all the time, but it does happen, and it will get bloody. Some amount of blood will come out. When Lantus hits the vein, it hurts. Not that it only hurts, is that all the Lantus sort of get absorbed right away. I went into a hypo. So that was scary. I mean, I was the lowest point of my life, and the symptoms I had was I was basically not thinking straight, feeling extremely hungry. I was sweaty. My sweat was white, like a white substance covered my entire body, head to toe. It was like cold sweat. It was really bad, and but I was still conscious. So I was telling my wife, like, I didn't know what was happening until I looked up on the internet later on. Was, when you hit a vein, sometimes the Lantus basically gets used up right away into your becomes a fast-acting insulin, even though it's slow-acting, basically gets dissolved right away. I was still conscious. I called my wife and I'm like, I need sugar now. Basically sodas. All basically, I was doing 15 units. To me, that's 150 grams of carb. That's, almost like 4 cans of soda, 3 cans of soda. It depends on what kind of soda you have. Basically, I was consuming all the sugar in the house because, ever since my diagnosis, everything is basically sugar substitute in the house. I was like, give me sugar now. I couldn't consume sugar fast enough. So that's it. Basically, you have to inject yourself every day. You have to check your sugar every day. You have to deal with needles every day. And it's just part of your life to survive. And all because of, our body does not produce this vital hormone, insulin. So this is basically, I don't know if we can show you, this is what I put in my pump. This is just a big bulk bottle. I think, if I'm correct, there should be about 250, almost 300 units of insulin. That's enough to last me almost 2 weeks. I would say 2 weeks. That little liquid, I don't know if you can see how little liquid it is. It's not even one sip of liquid is what I needed for an entire week. So it is a very small amount. It is insanely tiny amount that, that the amount of pain and needles and blood we have to go through to get that tiny amount of liquid in the right amount delivered into my body to keep me alive. It is just insane. It's just insane. So here it is. I no longer use this, but this is what you have to keep this with you at all times. This is the kit. This is what I have to live through every day. Sometimes the Novolog has to be injected at nighttime too. So what happened is, nighttime comes before bedtime. I would do my Lantus injection, and then check my sugar, and then you'd be like, oh my god, I miscalculated the dinner because it's some new place we've been to, and taking a shot in public, I'm very self-conscious. I have not done so because it feels like I'm a drug dealer taking drugs or whatever. So I've been doing the bathrooms, and oh my god, the cleanliness of bathrooms, I had a different requirement then because it's like, oh my god, I have to inject myself in this dirty place. Oh my god. So what happened is, like, I miscalculated dinner, and then I have to inject both. So my strategy actually is basically, I would switch hands with testing. Basically, let's say yesterday I tested with my left hand. Today I'll test with my right hand. On my right hand days, I would start injection on the left side. So I would do, Novolog, Lantus, because you don't want to mix the two. Remember, this one's acidic. The acid can basically make this become inert. So you don't want to inject these in the same spot. So if let's say it's the right hand test day, I would do breakfast, lunch, skip, dinner, and then nighttime. And then if I need to do a correction, I would just still do it not next to each other, but do it different side of the stomach. And then the next day, it's my left hand testing day, and I will do the Novolog right side, breakfast, dinner, and nighttime. So this will keep rotation as long as I remember which hand I test on. This way, it's a little game I play with myself. This This way I only keep track of which hand I tested on. This way my hand gets, prickly lancet rotation, and my injection site also gets a nice enough rotation that you don't want to use the same site over and over again, because when you do that, you have callus or become insensitive. You have to use longer needles. So you want to keep a nice rotation. I'll show you different rotation I use with my infusion set. So that's the game I play with myself. And also to help with my injection, remember my hands were like tremoring so bad, was shaking so bad. What I would do is I would breathe in, breathe out like 3 times, and then on the 3rd time I'll hold my breath in and then just do the injection, and then after the injection is complete, I breathe out. It's just like a routine, a sort of pattern. I say, okay, you have to do the injection. You're on a 2nd breath now. Okay, 3rd one, inject, because you promise yourself you will inject. That's the thing I tell myself. That's how I get over the fear of well, I haven't got over it. That's how I manage to deal with the fear. It's like, okay, first deep breathe. Okay, you're not there yet. 2nd one. Okay, 3rd one, hold it in. You have to inject. Then just basically do the injection, and then breathe out at the end and tell yourself it's done. And I also remind myself, don't let the injection process, the whole thing in and out takes probably 5-10 seconds. Don't let the 5-10 seconds of sort of unpleasantry to ruin your entire day. That's what I keep telling myself. So there you have it. It is very tedious, very hard work. But it's what I have to do to keep myself alive. It's what a lot of you do, and if you know someone with this condition, give them a hug. Show your support, and I hope you learned something from this. And if you are diabetic, I hope you can share me with some of your strategies. If you're not, I hope you learned something. This is what people on a multiple daily injection therapy has to go through. And I hope you like this video. And if you do, please like this video and subscribe to my channel. And stay healthy. Thanks for watching.